Hi, my name is Joey Gray, and this is my video analysis of Benny Joon for my MFT6102 Week 3 assignment. I'm going to begin by talking about the diagnosis of one of the characters and my supporting evidence. First of all, the character I'm going to be looking at is Joon. She is a young woman with a mild intellectual disability. Specifically, I have found from the website, from the DSM website, dsm.psychiatryonline.org, based on that website and what I found in the film, I'm saying that Joon has a dissociative identity disorder. So the dissociative disorders are characterized by a disruption of conscious as well as memory, identity, emotion, behavior, motor control, that type of thing. And so the reason why I think that that diagnosis suits Joon is because she, throughout my time viewing her, I noticed that she has some disruption, like the disorder from the website claims. She has some disruption of her consciousness. So there's a moment where she is out in the community and she kind of is unaware, or she almost forgets what she's doing and why she's there, and her brother, who is her primary caregiver, has to step in and kind of prompt her as to what she's supposed to be doing and supposed to be thinking, or what is culturally acceptable for her to be doing. So that's the primary reason why I thought her diagnosis would be a dissociative identity disorder. Something else about Joon, something else about the disorder and Joon that needs to be brought up is that the dissociative disorders are frequently found in the aftermath of trauma. So knowing this, it's important to recognize that Joon and her brother Benny have, their parents passed away and it was abrupt. So I believe that that trauma could be affecting Joon, could be the reason why Joon is being affected mentally and emotionally. Something else is the primary manifestation of the dissociative identity is that it affects your memory, right? So what things that happen today, skills that one has learned, like how to drive, how to write, how to do a job, that type of thing those types of things are affected by the dissociative disorder. Okay, so in talking about the primary manifests, in reviewing Joon's behavior in regards to the lapse of dependable memory, there was a time when Joon was roaming. I mentioned before she was roaming around the community. She ended up getting in trouble with the police because of some traffic violations she was causing by walking in the middle of the road. And so I assume that she has lost some of that dependable memory, the rules of the road, how to walk on the sidewalk, how to stay away from traffic because it's dangerous. Those types of things are really concerning in regards to how safe Joon will be without some addressing of her disability. So And going on, it says, in my reviewing of June, I've noticed that her outbursts, some of her angry outbursts or outbursts in which she doesn't know what to do, she can't control her emotions or her thoughts. She tends to lash out at people that are close to her. She runs away from the situation. In those instances, they seem to be triggered by high instances of stress. And with this, I believe that her dissociative identity disorder may be combined with anxiety or perhaps post-traumatic stress disorder, PTSD symptoms, because of symptoms of avoidance that she's exhibiting, negative altercations in cognition and mood, as well as hyperarousal that she's experiencing, because these types of symptoms occur after an individual experiences a traumatic event, which would support the idea that she's also experiencing some post-traumatic stress. A couple things I would like to rule out. Her behaviors and her diagnosis does not seem to be connected to any physical health or substance abuse. June's brother says that she has no history of abusing drugs or any other type of substance, and her eating is normal. I mean, she doesn't have any eating disorders as well. So as far as the physical factors of what she's putting into her body and some of these symptoms that she's showing that could be related to an eating disorder or a substance abuse issue, don't seem to be the primary cause. I would now like to talk about my description of the disorder, the dissociative identity disorder. According to the DSM Psychiatry Online article, the disturbances of dissociative identity disorder are not typical parts of one's culture. And so because of this, the signs and symptoms of dissociative identity disorder are mostly observed by others. In June's case, her brother has been most, aware of June's behaviors, and he's been the one who's going to the doctor's appointments and talking to the psychiatrist and trying to get the best help for June. What June is experiencing is she's experiencing, as I mentioned before, a disruption in her identity. So her sense of self is constantly not, in flow, or it's not a continuation. So she's having some disturbances with her sense of self. In particular, at one point she was going to leave her brother's house, and she was on a bus, and she had an outburst, I think because it wasn't her typical behavior. She usually lives with her brother, she loves her brother, she tries to get along with her brother as best as she can. So I think the idea of not doing what she usually does made her stressed out, and then she had a little bit of an outburst on the bus. Along with that, she has some alterations in her behavior, her memory, her sensory motor functioning, that type of thing. For example, in the morning, when she's alone without her brother and she gets ready, she tends to wear things that aren't typically what we would see in the cultural norm. She wears, from time to time, she'll wear a swimming mask in the middle of the day. She makes her cereal in a blender, which is not typical. So these types of disruptions of identity are directly related to the dissociative identity disorder. Something else that's associated with this disorder is recurrent gaps in the recall of everyday events. So when she gets in trouble with the police and she has to go to the station and then she has to call her brother, she has a hard time. She has a hard time realizing the effects of what she has done. So, like I mentioned earlier, I'm concerned about her safety, and specifically if she realizes what kind of harm she could have caused herself had the police officer not stepped in or somebody realized what she was doing. So another major symptom of dissociative identity disorder is that these symptoms cause clinically significant distress in social areas of functioning, among other, occupational, other important areas of functioning. And so this is definitely seen in Joon's behavior. The symptoms of this disorder is affecting her social area of functioning. Her brother has mentioned before to another psychiatrist that she has gone to hospitals before, she's lived in hospitals before, but she didn't like it. She wasn't able to get along with the other people. She's had in-home nurses before, but those didn't work out for her. She's run through several different nurses. So the symptoms that she's experiencing from the dissociative identity disorder are definitely impairing her social areas of functioning, both in the community and with other health professionals. More specifically with the dissociative identity disorder, the nature of this disease is that the word dissociate means separate. So in this case, we're claiming that Joon is separate from herself. She's separate from the cultural norms of how one should act. Another part of the nature of the dissociative identity disorder is that the traumatic events that young adults or children experience lead to PTSD symptoms, as I mentioned before, and mostly they're seen in children, and these traumatic events can, if they're not addressed, they can become more traumatic and have more of a stressful effect on these individuals as they get older. As far as the etiology or the cause of dissociative identity disorder, it is threatened by an unpredictable household. So that means that if Joon is experiencing the death of her parents, or if she doesn't know when her brother's going to be home from work, she doesn't know if she's going to have a new nurse, the fact that her home life is unpredictable, her home environment is not stable, that also relates to the cause of dissociative identity disorder. The course of this disorder is that, as I mentioned before, it's going to become more severe as the individual gets older, especially without treatment. Excuse me. This means that the effects on the individual, the biggest effect probably is that it's traumatic. This is long-term trauma that Joon is going to be dealing with, and it's going to affect her memory. So not only her memory of past things that have happened, but as I mentioned before with her incident walking into the middle of the street, it's going to affect her memory of what is appropriate culturally. What are the cultural norms? What are the rules that she's supposed to be following day to day? The systemic effects that it's going to have, meaning on the people around her, her family, is that the symptoms are going to be subjective, but there are going to be discontinuities in her speech and there's going to be flaws in her behavior as well. And the people that are going to be observing these flaws and these discontinuities are her family and her friends. So the systemic effects is that they're, because of these flaws, because of these lack of typical behaviors, is going to increase the amount of conflict that she's going to have with her friends and family. And also, with the loss of family members that June and Benny have both experienced, that means that that's also going to affect their dynamic, because it's going to be, there's less people and in their family that they can, collaborate with, they can talk to, they can relate to, or that they can look up to. So that's one of the systemic effects, is that it's going to affect, it's going to create more conflict between June and her brother specifically. Also, I would like to I'd like to add that the description of the disorder that I just mentioned, the information for that I got from an article by J. Douglas Brenner in Trauma, Memory, and Dissociation. And the other article I used was an article by Bessel A. Vanderkolk called The Dissociation and the Fragmentary Nature of Traumatic Memories. The next part of my video analysis is going to be the treatment plan. The model I am going to use is a marriage and family therapy model. I'm going to use a marriage and family therapy model because of all the systemic effects this disorder is having on her brother and also her boyfriend, which I forgot to mention earlier, but June's boyfriend also has an intellectual disability, but we're focusing on June, and her interactions with her boyfriend are mostly positive, but her boyfriend Sam has actually been a part of some of her outbursts and some of her loss of memory and social atypical behaviors. So it's important to mention him as being affected by some of the systemic symptoms of her disorder. Two specific interventions that I'm going to be mentioning in the treatment plan are long-term psychotherapy or talk therapy, as well as collaborative therapy with her other health professionals. So with June, we are going to be focusing on marriage and family therapy model, more specifically collaborative therapy and long-term psychotherapy. The initial phase of treatment, I want to make sure that we develop a positive therapeutic relationship with June. I want to be sure to analyze the cultural dynamics and identify dominant discourses. So what is, where there are misinterpretations or misunderstandings. I also want to come to an agreement with June about the therapeutic goals that we're going to accomplish together. I want to identify her needs, obviously, and I want, specifically, I want to increase June's ability to channel her outbursts and her anxiety symptoms. And I also want to increase her positive home environment. And I'm going to do that by increasing her positive interactions with her brother. So the working phase of treatment, I'm going to monitor June's progress towards our agreed upon goals and make sure our therapist-client relationship is stable. Then I would also like to monitor her conversations with her brother and administer a session rating scale for both of them. So how did you think today went? What are your, what do you think should happen next? That type of thing. Then I want to increase her moods. So her positive moods, obviously. I want to make them more balanced. by increasing her therapy sessions to 2 times a week rather than once a week. And I want to collaborate with her brother and her doctors to see what medications she's taking and what leisure activities she can do. So part of the collaborative therapy process is I not only want to collaborate with her brother, her primary caregiver, but I also want to collaborate with her doctors to see what medications they are or are not giving her. And I want to collaborate with the doctor as well as the brother to see what types of leisurely activities that June can get involved in that are positive experiences for her and that get her reconnected with herself, because the dissociative identity disorder, one of the main things is that the person feels disassociated or separate from themselves, and they're exhibiting those types of behaviors. So June loves to paint and she loves art. So art therapy or an art class, or maybe her teaching an art class in a community center, could be a very positive way for her to aid feeling more comfortable with herself and limiting her stress. And then the other part of the working phase of treatment I want to focus on is I want to increase positive interactions between June and her brother. And I plan on doing that by reinforcing her ability to reflect and speak on her needs. And obviously, that her being able to reflect on what she needs will decrease her outbursts, and it'll increase her modes of communication, and she'll have less stress because she's able to communicate what she needs because she's reflected on those needs. That exercise is what I think will really build a strong relationship between her and her brother. As far as the closing phase of treatment, I want to create a plan that will ensure that June is following through the prearranged goals that we've decided upon, and that I want to make sure that she reports on having more control of her mind, that she feels more, in tune with herself. And I also want to make sure that she's reporting back as to having a better relationship with her brother, and I want vice versa. I want Benny to claim that he also sees improvements with June and that he feels better about interacting with her as well. I want to use scaffolding conversations to increase June's understanding of her own emotional well-being. Like I said before, being able to reflect on what she needs, open that mode of communication, express herself through art, find herself there. I want to encourage her to keep doing the things that are helping her and that are culturally normative. And the last thing I want to do is I want to increase her external relationships that support June's preferred identity to reduce her sense of isolation. So I want to make sure that Benny knows that him supporting her, as well as Sam, her boyfriend, I want to make sure that Sam and Benny and any other members of the community that she's close with, I want to make sure that they know what we're working towards and what will best benefit June. So like I said, that support and making sure that Sam and Benny are both encouraging her and being supportive and loving of her rather than lashing out at her or causing her any type of stress that's unnecessary because of something that they might be struggling with, which is another reason why that, June's working on open communication. So we can all work on open communication of what's really going on so that we can all feel like this is one. This is something that we're working on together so that nobody feels isolated, especially June. The client's perspective, obviously, I want to make sure that this treatment plan is looked over and analyzed with June so that we can both be on the same page and I can take note of any concerns that she might have. And this treatment plan that I've come up with is adapted from the Gerhardt text, 2014. It's her treatment plan example. And with that, I will conclude my video analysis of June, which I observed from the video Benny and June, 1993. My name is Joey Gray. This is for my coursework MFT6102, week 3 assignment. Thank you very much.